Greetings. Today I'm going to talk about the latest and greatest, the best weight loss peptides and medications for fat loss in Sarasota, Florida. In the battle against obesity and metabolic dysfunction, 2026 is serving up a buffet of innovative peptides and medications that go beyond calorie counting to supercharge fat loss and optimize metabolism. As a progressive medicine specialist, I'm here to break down the latest injectable and oral heavy hitters: Semaglutide, Tirzepatide, Retatrutide, Tesofensine, SLUPP332, Tesamorelin, and MOTS-c. With George Carlin's razor-sharp wit in mind, let's cut through the hype. We're all just chasing a slimmer waistline while Big Pharma's laughing all the way to the bank. Here's the lowdown on these game changers, including dosing, approximate costs, and side effects to watch for, so you can make informed choices without swallowing the glossy ads whole. Because weight gain is a pandemic, and healthy weight and fat loss is the most difficult thing in all of medicine, most people simply need more metabolic support. Fat storage is a key to our survival. It is our primary storehouse of energy substrate. Therefore, we've developed a complex system designed to add to and maintain those fat stores. Modern life has made the need for significant fat stores obsolete, but our bodies and minds didn't get the memo. Metabolic dysfunction, think insulin resistance, visceral fat, and sluggish energy, is a root cause of obesity, diabetes, and heart disease. These therapies target appetite, fat metabolism, and cellular energy, offering a science-backed edge over willpower alone. From GLP-1 agonists to mitochondrial boosters, they're rewriting the rules of weight loss. But, as Carlin might quip, are these miracle substances or a deal with the devil? My quick answer is that they are neither, but they can play a significant role when used along with proper diet and exercise. Let's dive into the specifics based on the latest data after a crash course on receptors. These structures live on the outside of our body's trillions of cells. They are vital to cellular signaling and communication. Today we'll focus on three of them. GLP-1, glucagon-like peptide, promotes insulin secretion, slows digestion, and reduces appetite. GIP, glucose-dependent insulinotropic polypeptide, enhances insulin release and lipid metabolism, complementing GLP-1's effects. Glucagon GCG increases energy expenditure via brown adipose tissue thermogenesis, promotes fat oxidation, and enhances metabolic flexibility. Semaglutide, Ozempic, and Wegovy, blockbuster meds. Semaglutide is an injectable GLP-1 receptor agonist, with an oral version also available. GLP-1 stands for glucagon-like peptide 1. It works by mimicking the GLP-1 hormone, boosting insulin production, slowing gastric emptying, and curbing appetite. In clinical studies, it achieves about 15 to 20% body weight loss over 6 to 12 months. It is administered as a weekly subcutaneous injection, starting at 0.25 milligrams and gradually titrated up to 2.4 milligrams over 16 to 20 weeks. The key principle is to start low and go slow, increasing the dose only when necessary because of receptor attenuation and adaptation. The retail cost of Wegovy is approximately $1,349 per month without insurance, while compounded versions typically cost around $250 to $500 per month. GoodRx 2025. The most common side effects include nausea, constipation, bloating, and fatigue, particularly during the early stages of treatment. Although uncommon, serious risks include pancreatitis, gallbladder issues, and vision loss. Patients should be monitored for gastrointestinal problems, and semaglutide is not considered safe during breastfeeding due to limited data or for individuals with a history of pancreatic disease. Tirzepatide, Mounjaro, and Zebound. Tirzepatide is an injectable dual-action GLP-1 and GIP agonist, with an oral version now also available. GLP-1 stands for glucagon-like peptide 1, while GIP stands for glucose-dependent insulinotropic polypeptide. It works by targeting both the GLP-1 and GIP receptors, enhancing insulin sensitivity and suppressing appetite. Clinical studies have shown that it produces approximately 20 to 22.5% weight loss over 6 to 12 months. New England Journal of Medicine 2022. It is administered as a weekly subcutaneous injection, starting at 2.5 milligrams and gradually titrated to 5 to 15 milligrams over 12 to 20 weeks. The retail cost of Zepbound is approximately $1,059 per month without insurance, while compounded versions generally cost around $400 to $800 per month. The most common side effects include nausea, diarrhea, and vomiting, which are usually mild and temporary. Rare but serious risks include pancreatitis and a potential risk of thyroid tumors based on animal studies. Tirzepatide may also lower blood pressure, which can be beneficial for some patients. However, it should be avoided in individuals with a personal or family history of medullary thyroid cancer. Retatrutide is an injectable triple-action agonist that targets GLP-1, GIP, and glucagon receptors. GLP-1 stands for glucagon-like peptide 1, while GIP stands for glucose-dependent insulinotropic polypeptide. It works by activating all three receptors to maximize fat loss while providing a significant metabolic boost. Clinical studies have demonstrated up to 24.2% body weight loss over 48 weeks. It is administered as a weekly subcutaneous injection, with doses ranging from 1 to 12 milligrams, typically starting at 0.5 to 1 milligram and gradually titrated every 4 weeks as needed. Compounded versions available from unapproved sources generally cost around $500 to $1,500 per month, while the estimated retail price following potential approval is expected to be $1,100 to $1,400 per month, projected for 2027. The most common side effects include nausea, vomiting, and diarrhea, which are generally dose-dependent. Although long-term safety is still being studied, the current clinical data are highly encouraging. Retatrutide is not currently FDA approved and is therefore only available through specialty peptide manufacturers. The FDA advises against using peptides outside of approved or experimental applications and discourages the use of compounded and research versions. If obtaining Retatrutide from a specialty source, it is important to ensure the manufacturer is reputable and follows good manufacturing practice (GMP) standards. Tesofensine, oral triple monoamine reuptake inhibitor. Action boosts dopamine, serotonin, and norepinephrine, suppressing appetite and increasing energy. Significant weight loss in trials, The Lancet, 2017. It is taken as a daily oral dose, typically starting at 0.25 to 1 milligram, adjusted based on response. The cost is approximately $250 to $600 per month for compounded versions, which have limited availability. The most common side effects include increased heart rate, dry mouth, insomnia, and restlessness. It is not recommended for individuals with heart conditions or anxiety. Concerns: requires cardiac monitoring in those with known heart conditions and is newer and therefore less studied than GLP-1 agonists. SLUPP332, oral ERR, estrogen-related receptor agonist. Action: mimics the effects of exercise, boosting mitochondrial function and fat metabolism. Early trials show promise. Dosing: not yet established, but it is expected to be taken as a daily oral medication, with clinical trials still ongoing. Cost: currently unavailable through conventional big pharma sources due to its preclinical status. The estimated cost following approval is expected to be $500 to $1,000 per month. Meanwhile, there are trusted peptide sources that have it available for well below half the anticipated brand name price. Side effects: unknown, with potential hormonal effects due to ERR targeting. Concerns: experimental, with limited human data available at this time, although it has shown promising results in study animals. Further details are expected as clinical trial results become available. Tesamorelin, injectable growth hormone releasing hormone, GHRH analog. Action: reduces visceral fat by stimulating IGF-1 and supports metabolic health. Dosing: administered as a daily subcutaneous injection at a dose of 2 milligrams. Cost: approximately $1,200 to $2,000 per month for the brand name version, while compounded versions typically cost around $300 to $600 per month. Side effects: the most common side effects include injection site reactions, joint pain, and elevated IGF-1. Rare side effects include glucose intolerance. Concerns: IGF-1 and glucose levels should be monitored, and it is not recommended for individuals with cancer. MOTS-c, injectable mitochondrial-derived peptide. Action: enhances mitochondrial function, improves insulin sensitivity, and increases fat burning while supporting muscle preservation. Cell Metabolism, 2021. Dosing: administered as a weekly or bi-weekly injection, with doses ranging from 5 to 15 milligrams, depending on the treatment protocol. Cost: approximately $200 to $500 per month for compounded research-grade versions. Side effects: mild injection site reactions, while long-term safety remains unclear. Concerns: a research peptide that should be used under medical supervision due to limited available data. Who benefits? Ideal for obesity, insulin resistance, or metabolic syndrome. Semaglutide and Tirzepatide are FDA approved and widely accessible. Retatrutide and SLU-PP-332 are investigational but still available through trusted sources. Access: Semaglutide, Tirzepatide, and Tesamorelin are available via prescription. Retatrutide and MOTS-c are primarily available through clinical trials or compounded. SLU-PP-332 awaits trial data. Cost management: compounded versions are cheaper but riskier if not from a trusted source. Insurance may cover Semaglutide/Tirzepatide for diabetes/obesity. Check savings programs, for example, Lilly for Zepbound. Safety: start with low doses and go slow to minimize GI side effects. Monitor labs, glucose, lipids, liver, IGF-1. These peptides and medications are revolutionizing fat loss by targeting appetite, metabolism, and mitochondrial function. Semaglutide and Tirzepatide are proven powerhouses, while Retatrutide and SLU-PP-332 push the boundaries. For a closer look at the three GLP-1 injectables on their own, see our deep dive on weight loss peptides in Sarasota, and for the mitochondrial side of the equation, read our comparison of MOTS-c versus Tesamorelin for fat loss and energy. Don't just pop pills and expect miracles. Read the fine print and do your homework. Work with a provider who has vetted their sources to tailor dosing, monitor side effects, and pair with a nutrient-dense diet and the Foundation Nutritional Support Program, available by emailing doc@artc.health and requesting a copy. Your health and metabolism deserve more than a quick fix. Give it the science and logic-backed tools it needs. As always, feel free to reach out with questions, comments, and requests to go on our supervised peptide observational research trial with us. Contact info at artc.health.